So with that, Laura, did you want to go ahead and intro for us, please?
Sure, happy to. Good afternoon, everyone. Thank you very much for joining our webinar today. We apologize that we had tried to host it at an earlier date, but due to all the responses of the Louisiana flooding and storms that swept through in the last few weeks, we decided to delay it, since those who were responding were probably the ones who were interested in this information. So I welcome you to our webinar today. My name is Laura Wolf. I'm the manager of the Critical Infrastructure Protection Program under the Assistant Secretary for Preparedness and Response at the Department of Health and Human Services. As you know, we manage a public-private partnership working together to enhance security and resilience of critical infrastructure. And a key issue in that partnership continues to be getting the right people and goods where they are needed in order to respond to and recover from disasters. So over the last year, we were able to fund a project for Healthcare Ready to look into what the existing mechanisms for crisis reentry and credentialing were, and come up with some recommendations for programs that were being set up. So today we're very happy to have Emily Lord joining us to present that great work. Emily Lord is the Executive Director of Healthcare Ready, formerly known as RX Response. It is a nonprofit organization set up in the wake of Katrina to ensure that the catastrophic breakdowns in patient access to healthcare wouldn't happen again. And so Emily and her team continue to do the difficult work of bringing together the government, NGOs, and private sector partners to enhance response and recovery in the healthcare system. Emily is a close partner of ours as well in the sector. She leads our pharmaceutical labs and blood subsector of the Healthcare and Public Health Sector Coordinating Council, and she continues to be a resource for us of critical expertise and bright ideas. So we're excited to hear from her today on the great work her team did. So Emily, thanks for being with us. I will remind everyone to please mute your phones until we have a question and answer period. And with that, Emily, I turn it over to you.
Great. Thank you, Laura, and welcome to everyone. I'm happy to be here today and talk about an issue that we've experienced quite a bit at Healthcare Ready. Before I get started in that, I'm going to go very quickly, just 2 slides. Laura did an amazing job of introducing who we are and what our nonprofit does. But we work to strengthen communities by collaborating with public and private sector before, during, and after disasters and disease outbreaks. So we really do the whole gamut, really making sure communities are resilient. And at the end of the day, patients can continue to have access to health care no matter what happens. So in that, we've been around for just over 10 years at this point after Hurricane Katrina. We've activated for over 60 responses. I think we're more at 65 at this point. We've activated in all 50 states. We've activated for all manner of different events. And we spend a lot of our time in those disasters, just like in the Louisiana floods this last month, sharing info, coordinating, answering questions, donation help, and really helping to ensure that healthcare is running. So really getting down to the supply chain and figuring out what's happening and where are the barriers, where are things not getting through, which will then lead to patients not having access. And speaking of access, the topic of our presentation today, it's a top request that we get. It's actually the #1 request that Healthcare Ready gets when we're actually activated for a disaster. So it's something that we've seen for 10 years. We've seen it in every different kind of event, every different location, different size. It's been recurring, and it's one of those chronic issues that we've seen that we really wanted to dig into and understand the underlying challenges behind it, and then what's being done to really address it. So next slide, please. So available today, we are rolling out our report, Access Denied, on our website. You have the URL right there. That actually takes a look at this issue. And it really is a landmark analysis where we've talked to every program in the United States. We've looked into all of them, and we've laid out what exists, what solutions are out there, and what things are still remaining to be done. It's really the culmination of about 6 months of work with ASPR and with Laura's office, but really 10 years of responses and interest in this space. We're calling it a soft launch today because we're going to have a final version in the next 2 or 3 weeks when we have a foreword provided by the Assistant Secretary for Preparedness and Response. But the report is available right now on our website, and we welcome you to download it. So background really quickly about the effort that we undertook. It's an issue that a lot of people have come from a lot of different perspectives, and we knew that the only way to really understand what's going on would be to really get out there and talk to all sorts of people. We started out with a legislative analysis that looks at all 50 state laws, dig into what actually is written on this, what are people mandating has to be done, and what other programs are being created. And then we went ahead and did a survey that talked to over 128 respondents about their experiences with this issue, what solutions are out there, and what is really going on. And then even more in-depth interviews with some of the key contacts in our space. So really trying to get a full landscape of what's happening and really have a baseline of what's going on. For that, we had input from a lot of different folks. I think a lot of you on the call, and I just want to express my thanks for taking your time and sharing with us your wisdom and your experience. And throughout this presentation, we're going to have different quotes and different things we pulled out from our different interviews. But I think you can see from this list here, we have folks from retail and telecom and energy and construction. This isn't just a healthcare issue. This is an everybody issue. Healthcare Ready has certainly looked at it from a healthcare perspective, but this is something that is facing every sector out there. So even though all of us are thinking about it, this has been an issue we've heard about a lot of times, we're coming at it from a lot of different perspectives. Our analysis and our report tried not to just take in the private sector perspective on the issue of disaster access, although that is a big component of what we did. We also tried to look at it from law enforcement perspective, emergency management perspective, public health perspective, and bring in all of those different viewpoints and opinions and understanding the challenges they all face, because it's the only way we knew that we could really come up with some good, strong recommendations for how to make these make this issue better and try to improve it. I have to say, this topic of access into disaster sites is the only topic that I've seen at a conference people actually raise their voice. Can we ask everyone to mute their phones? Thank you. It's the only topic I've ever seen at a meeting where people actually stood up and yelled and shouted at each other from across the room for over an hour. I really thought it was going to come to blows at one point. So it's something that, sounds like an issue we should be able to address, but I think as we dig into it, you're going to see that there are a lot of complexities here and a lot of reasons why this has become so intractable over the decades. We actually found a report from the National Governors Association from the 70s that looked at the same issue as well. So this is not new. And what's new is there's been some great effort and progress being made on it. And what's new is this is the first time we've really had a landscape of everything that's happening with it. So next slide, please. I'm going to talk just a little bit and really try to lay the foundation of why this is an issue and what's happening after these events. It's something that we've seen even just a few weeks ago in Louisiana. Law enforcement has some very specific goals when something happens, when a natural disaster strikes and a community is devastated. The things up here are incredibly simplistic. It doesn't show at all the breadth of the things they have to deal with after something hits the community. To really think about it, you have to step back and see what they're seeing. They're seeing a community destroyed. They're trying to get control of the situation and protect all the people in that community. And frankly, it's something they're not used to seeing. This isn't your run-of-the-mill kind of just, weekly shutdown of roads or something happening with construction season. This is a devastation of a community, and it's overwhelming, and they're trying really hard to get control and protect it from crime and from looting, but also to make sure that anybody who's coming into a restricted area doesn't accidentally drive across, live wires or have a dangerous building collapse on them. Law enforcement is coming at it from a perspective that, we need to protect this community, protect the area before we can start to let anyone in. And I think that's something we can all agree on. We want to make sure that everything is under control before adding any other kind of variables to it. And that is incredibly important. But the challenge hits, because we understand their perspective, the challenge hits because private sector is required for response and recovery, especially in healthcare, where, as on the first Healthcare Ready slide, there's over 90% of healthcare that's owned by the private sector. we want communities to keep having access to healthcare. We have to make sure healthcare can get moving, can get into the area. And I don't mean just, the doctors for the ER, although that is incredibly important. I also mean the delivery trucks, delivering medicines and supplies. I mean even the telecommunications that have to get the power so that we can get facilities up and running and communication. It's incredibly important they get in there, and the longer they don't, the more community doesn't have the ability to really start responding in recovery. And it obviously has to be balanced with the understanding that, it does safety and entry somehow have to come in some kind of coexistence. And until the area is deemed safe by law enforcement, that's simply not going to happen. But once that's done, and done as quickly as possible, understanding who's critical and letting them into that area is incredibly important. Next slide, please. Thank you. And if they don't, as I mentioned, it delays critical supplies. It delays community recovery and response. We saw it directly, at Hurricane Sandy, where I got a call with a truck trying to deliver oncology medicines to a cancer hospital in Midtown Manhattan, and they couldn't get across the bridge. And they're calling me, and they're incredibly frustrated because they need to get in, and they need to get these folks their medicine to protect these folks in treatment. And really, they just couldn't do it. They were delayed by at least a day until we could get them some kind of access and we could arrange a police escort for them. And it really is just compounded by all these other sectors, too, who need to get in and provide access. So it's overwhelming. You can understand it. If you're a law enforcement officer on the ground, who do you decide is important? Who gets priority access? How do you understand what is critical and what the domino effects there are? It's really a challenge, and that's why we need to think about this problem and all the solutions ahead of time, so that when something happens, it's not just left to the person on the ground to try to make a gut check and do whatever they can. So I'm not going to go into all of the reasons why this is a complex issue. There's details in our report, and I think that'll be much more details we need. But the fragmented solutions, we hear a lot of times that the challenge is that different jurisdictions have different solutions, and different jurisdictions don't talk to each other. And the way that healthcare flows and the way that supply chains flow is you can't just show up on the door and knock and get in. You have to go through a whole bunch of other jurisdictions so you can get there. They all have different programs. They all have different people running those programs. It's really hard to learn how to coordinate it. And home rule, a lot of the private sector organizations we talked to said it'd be great if we could have a national solution or a regional solution or even statewide solutions. And yeah, it absolutely would be. It would make it much easier from the private sector perspective. But unfortunately, things like home rule means that the lowest level jurisdiction have the authority of whether or not to implement these programs. So we've seen challenges even in states like Washington State that's working on a program and doing some fantastic jobs developing their program right now, but they're still having to navigate how do we get all of the localities to participate and be engaged and adopt this program. And costly, it is costly, and I don't just mean money, although I do mean that as well, for time as well. Coming up with solutions for this, they're not easy, and you have to put some effort in up front, and that takes hours and effort. So it can be costly for both of those. And communications, again, when you have a patchwork of solutions, letting people know that they exist, especially if a company is not headquartered in your state, it can be really hard to even know who you contact, who you enroll into a program, or whatever you need to do, what steps you need to take before something happens. And then when something happens, you're left scrambling, trying to find the right person, the Emergency Operations Center, or wherever else you can try to coordinate with. And then for supply chain, we get into this in quite a bit in our report, but healthcare specifically, healthcare operates on a just-in-time supply chain. It operates with 24 or 48 to 72 hours, basically, usually, of supplies that are available in the pipeline in a facility, and then they have to get more. Healthcare also has very unique supply chains because they usually do what we call third-party logistics providers for the end and their last-mile delivery. So we have white courier vans that are unmarked. The driver doesn't always know exactly what's in them, trying to make deliveries into an area that's restricted. Of course, the police officer on the ground is going to think that looks sketchy, and they're going to question who's in there and do they have a right to get in there. So figuring out how we get those folks to be connected and in so that they can get in and make those last-mile deliveries is incredibly important as well. And it's also a challenge because the sectors have different viewpoints and different motivations on a lot of these things. As you see here, for the public sector, it's their job to make sure people actually know about it, and that's not easy. It's one thing to have a program that's run by emergency management. It's another to have the police officer, who's National Guard, or whoever at the corner understand that program and adhere to it. And it's another to understand that all of the different ESFs know about the program and all of the companies that could potentially want to get into a jurisdiction know about it. That's no easy feat. And the jurisdiction issue, we highlighted a little here and a lot more in the report, but it's incredibly hard to get things from point A to point B in those times. And we do weight restrictions, we do hours where drivers can actually drive extended hours, we change a lot of things. But if the roads are shut down, we can't get them in. And often if an event is localized, we saw that in Sandy too. If you needed to get into the directly affected states, you could get in typically pretty quickly. But if you were trying to get through some of the other areas, they were just not letting you in to even get there at all. They were not letting anything in. And so as you can see, those are challenges that are very unique to those places. But for private sector, they also don't have full-time people who are just trying to make relationships with every state emergency management agency. Some of the big companies do, and that's fantastic. But trying to understand who you coordinate with, how that works, and then understanding who is critical. The definition of critical is something that is really hard to define. We had a hospital tell us as we were doing these surveys that, their doctors and the nurses were incredibly critical. But what was the most critical, or the second or third tier, right up there was their janitorial staff. Because if they couldn't get them in, then they weren't going to have any bed sheets changed. They weren't going to be able to keep patients there. And so figuring out who is critical and kind of having that foresight to understand all those complexities, it's not easy. And then additionally, trying to make sure that those folks are registered with the right organization is also very difficult. So the way that Healthcare Ready went about this work is we broke it up into two parts. One was looking at current access programs that exist across the United States, and then providing recommendations for folks that are developing programs or running programs going forward. So the current solutions, and I'm going to actually turn it over to my colleague, Nicolette Lewis-Saint, to chat just a little bit about what exists for current solutions and at a high level, and then we'll get into actually what states and what programs are there for you and your companies or organizations to connect with. Sure. Thank you, Emily. So we've heard a lot of feedback from all of our colleagues and stakeholders on this issue, and there's a clear desire for a federal solution. And we've heard a lot of rationale as to why a federal solution would be easier in terms of communication and just understanding what the existing program would be. And I think many of us, if not all of us, can agree that as disasters and events are managed and responded to at the local level, moving up, it also does require that the access solutions are managed at the local level as well, for a lot of the reasons that Emily's already laid out. But what we do think is possible is a guidance and possibly even a framework that could exist at the federal level that could help inform the programs that are coming online right now. So while I don't personally foresee a federal solution or a federal program being rolled out that would be operated in all 50 states, I do think there's an opportunity to take some of the best practices that exist right now across a number of states and cities and create a guidance and a central framework from which the local programs, state and the local programs could operate. I do want to point out that we are aware that the NIC has been working on a report on this issue for about the last 2 weeks to 2 years. I apologize. And it's been in development for a while. And we do understand that while they're working on this issue and trying to create an extensive report on this, it's going to be more at the policy level as opposed to a rule or program. So we are looking forward to the rollout of that report as well. But as many of you have asked about it also, we expect that will really be more of a policy level guidance. As Emily mentioned, one of the things that we did look at were legislative statutes and understanding how legislation played a role in the access programs that were in existence. And ultimately what we found was that there are a number of states that are introducing legislation to motivate the emergency management agencies or mandate them to create programs. However, there are a number of states that aren't. And I just have here a quick highlight of 4 states that have introduced legislation on this particular issue and mandate the existence or creation of a program to address access through legislation. But it's important to note that there are a number of states that have access programs that are very successful or being rolled out sometime in the next year that are not using legislation. So while legislation may be an opportunity to create a program or to mandate the existence of a program, it's also possible to create a strong program through the emergency management agencies without one. Great, thank you, Nicolette. So how do people try to get around this issue, and what are they doing right now to get into restricted areas after these events? We've brought it into 2 buckets here. There are formal programs that exist, and then there's ad hoc solutions. Ad hoc solutions take many different forms, so we've highlighted 2 of the biggest and most successful that we've seen, and we're going to go into more detail throughout. Thank you. So here's a quick map that lays out states that have states, cities, counties, or in development programs, and this is also in the report, so you can see it, and we get into more detail on all of these. But as you can see, I think, actually, you can't see, but if you had seen a map 3 or 4 years ago of how many states had programs, it would have been about a quarter of this. So there's tremendous growth in these programs, and not only are they growing from, cities, but they're becoming statewide too. And these are the actual formal programs that are being run either by the EMAs, city or county or state EMA, or through third-party access programs. Next slide, please. I'm going to talk for just a minute about the state and city level programs. These are ones that all require pre-registration. North Carolina has a fantastic example of one that they use. You renew it every year. It's managed through their EMA, that's through their private sector liaison, and their BEOC, their Business Emergency Operations Center. And they use it to issue a badge or a letter or some kind of document that you can actually use on the ground, but it connects back up to a database so they can verify the people who are enrolling in it. The most successful of these run it through their web EOC or other information sharing platform. We've heard of some that have tried to create their own systems to manage it, but it seemed most successful when folks have been using pre-existing programs. And those states, Florida, Illinois, North and South Carolina, and Washington are programs that are either have programs, have new programs, or are going to have programs up very soon. So we have advantages and disadvantage slides for every type of access program. I don't mean this to be at all negative. It's just to show that there's really no perfect solution to this issue, and everything is trade-offs. So some things make them much stronger, and some things make it difficult to use these programs. But for the formal programs, it's great that you can register in advance. But it can also be a challenge, right? Because if you don't know how your employees are turned over, or you don't know who your third-party logistics driver is going to be that day, it can be hard to get and make sure that they're in the system as well. But one of the biggest strengths of these programs, at least on the state level, is it is the whole state. You're not doing a program that's just in one city, which is great for that city, but not if you have to get to that city. And it's very helpful for folks to need only one relationship to manage to get into that program. And also, there's no cost for the private sector participants, and that's something that is controversial. But we've heard from a lot of folks that, it takes effort and it does take cost by the state. And often, especially in North Carolina, you have a liaison who's dedicated to creating these programs. That's a significant investment. But it doesn't cost and there's no fee if you're on the private sector and you're trying to get into those areas. And frankly, these are the most reliable. They're programs that people know about. They're ones that hopefully are turned on for different types of events, so there's some socializing of them. And so folks can understand how to connect with it, and hopefully the folks on the ground will learn to recognize it as well. But as we companies who aren't headquartered in your state, Ohio has a great program, but it's hard if you're not headquartered in Ohio to know, who runs it and how to connect with it and how to get registered in it, which is a problem then if there's an event in Ohio and you still need to get in. So we have some notable programs. We actually pull out in the report best practices from programs throughout the country in one of the appendices. But here, as I said, Florida has a great program that's just come online in the past year. Chicago is doing one just within the city, but it's also been very successful. And then North Carolina, we heard time and time again. Persia, hopefully she's on the call. She's fantastic. I highly recommend everyone connect with her. Email me and I will give you her information. So the other type of program that exists, so we have these state-run programs that are owned by the government, run by the government. Then we have state or city-run programs that they contract out, for lack of a better word, with third-party providers. There's two of them that operate the biggest two in the country, and they work mostly regionally. The first is SEAS. Up here. It's primarily in the East Coast. It's right now it just went statewide in Massachusetts, and it's targeted to go statewide in Rhode Island by the end of the year. And it's in cities up and down the East Coast otherwise. This is a program that the state basically opt in to using, and then the third-party program, SEAS in this example, charges a fee to the companies who want to participate in it. The fees are sliding, so it's hard to say exactly because it depends on the size of your organization, how many people you want credentialed, where you want to get them into, how many locations, etc. So the fees very much differ. And fees is unique as well because as you participate with this program or in any of these states that use this program, they require proof of liability coverage, which most companies already have, but you have to demonstrate that you have that before you're allowed into access. And it basically goes all the way from Boston to Baltimore, all along the eastern seaboard. The other third-party program that folks use is more in the Gulf area, called ERITN. It as well is statewide in 2 states, and it is regionally wide in Texas right now. It again has a fee. The fees go for ERITN. They're by badge, not by organization. And again, they're sliding scales, so it's really hard to nail down exactly what an organization will pay to participate on it, but there's a range at least on here. Both of these systems have an online system and an app that you can use to verify the credentials, but they also have redundancies built in place for if there's lack of communication or power outages, and you can't have access to the app. One of the strengths of having that app is that you are able to send it to anyone, and you don't have to physically get them some kind of paper or credential, and that can be easier. These third-party programs, they have similar advantages to the state program, except for the level of effort is placed on the state EMA to run it and to manage the enrollees and to maintain all of that. The other great advantage of these programs is that they can work across jurisdictions. That can be really helpful if you're trying to get up and down the eastern seaboard. One of the negatives, the disadvantages that we heard was that there's a cost for users. And some of the private sector organizations we talked to just said flat out, they will never pay a cost to participate in a program. It doesn't matter what it is. Some of them are willing to pay. I think it's a price to pay to manage it. But it certainly makes these programs more controversial, that burden is shifted onto the participants instead of the government for it. But it does still have a number of strengths. Here's a couple examples just so you can see often what the badges look like. So they both use different kinds of tiers to participate and to understand who gets access when. SEAS uses ones that let you go into either multiple facilities or a single facility, and it's tiered. ERITN has tiers that are based on the criticality that you're deemed. So they have ones that are, the emergency level, tier 1, where you're going to get in right away, and then all the way down to tier 4, dependent on how they deem your criticality needing access into the area. So I'm going to pass it over to Nicholas Colette again for a minute just to talk about some of the ad hoc solutions, because we know that not all states can develop formal programs. As much as we think it would be fantastic, we think it would really help this issue, there are some states that are not going to have the capability to do that. So there are some other solutions that are tried and tested that we've seen at a lot of different events. One of those solutions is actually incorporating language governing access in an emergency declaration. And there are just two examples here from New York, one from Hurricane Sandy and one from Winter Storm Juno, both very different events, but we just incorporated as an example the type of language that you might see in an emergency declaration. And so we do know that there are a number of jurisdictions that actually rely on using emergency declarations as a way to facilitate access. They have in the emergency declaration a few sentences about what the travel ban is, how the travel ban is going to operate, and what the exceptions are. The challenge that we've heard from a number of private sector partners is that it's not always clear when the emergency declaration is going to be issued and who's reading it. So if there isn't consistency in the language, if there isn't consistency in how to kind of make it through or navigate the emergency declaration to understand who is actually allowed to come in, there can be challenges in actually interpreting it and also making sure that law enforcement has interpreted the emergency declaration in the same way and views a 3PL driver, for example, a third-party logistics driver, as critical personnel based on the language in the declaration. So just to quickly go through the advantages and disadvantages for this particular ad hoc solution, the advantage is that it's applicable to the entire jurisdiction and that governors can or mayors can create flexible declarations based on the need at the time. And declarations can be created ad hoc and disseminated quickly. The challenge, though, is that sometimes there's a lag in how long it takes for the declaration to actually be issued. This can go as high as 48 hours after the event, where an individual may be waiting to get the language and understand what the restrictions may be. And as I've mentioned, the declarations are different, and so different declarations have different language, so it can be difficult to understand sometimes where to look in the declaration or what type of, what language you should be looking for in the declaration, and whether or not law enforcement has reviewed it and interpreted the declaration in the same way. Another solution that actually is something that we at Healthcare Ready have familiarity with is the idea of creating an access letter. And the letter can be from the company or maybe even a public sector partner requesting access and explaining the nature of the business that the company has and why they need to get in. That letter would then be printed out and presented to the law enforcement official at the actual barricade. And on the slide, you'll see three types of letters that we've seen in our experience. One's from companies, one's from the BEOC or EOC verifying that company, and then one from a partner like Healthcare Ready, a credible partner to coordinate with government and describe the need for access. And as I've mentioned, that's something that we've had familiarity with, and it's something that we've had to do in the past in response to a number of events also. And with these access letters, one of the things that's very important to remember about the letter is it's a physical letter. And so that letter would have to be drafted, approved. Many of you who are in government, I'm a former government staffer, understand the clearance process and what that can take. So there may be a lag in actually getting the letter, but then it has to be printed and physically handed off to the driver. And so that can be a challenge when there are limitations in internet access or other communications. They are easy to develop. There is language that can be pulled together very quickly. So it's not a challenge, but it does still have to physically get to the driver. And we do know that a number of organizations have experienced both developing and issuing these letters for a number of events. And we also, because it's a physical letter, do want to acknowledge that there's an ability to actually transfer that letter from vehicle to vehicle. And so that single document can be shared between vehicles and used, but there is no guarantee that the letter is going to offer success, and law enforcement still has to accept the letter. And the process does have a level of insecurity that has to be considered, and it could result in fraud. And we have heard stories and examples of companies experiencing that, where there were issues of forgery or lost letters. Yeah, thank you, Nicolette. And I have to say, too, in Hurricane Irene, I think it was, we were requested, there wasn't a program in place. We had a lot of folks who were trying to get into places that were not used to dealing with hurricanes and hurricane response. And so coming up with a letter where we coordinated with FEMA, we coordinated with HHS, so we got all of the logos on there, and we're able to say this is critical for XYZ. It took time. It took probably 24 hours to get a letter out. It was more successful, though, once it was out. So it's one of those things where it's an imperfect solution, and it's not something we would go ahead and recommend as the first thing, but it really is a tool that can be used, and it's something that a lot of companies don't think to coordinate with multiple parties on to try to get it out there. But we certainly have seen it have success. We've also seen it on the ground where the driver has in one hand an emergency declaration, in the other hand one of these access letters, and waving it, and then, call the EOC, and that has worked as well. The problem with these types of ad hoc solutions is you just don't know if it's going to work. And it really depends on the person on the ground, and it's riskier for sure. But for the places that don't have programs in place, if you're trying to figure out what to do, that works as well. Coordinating with a lot of these EOCs and business EOCs and national EOCs, all these groups is also incredibly important. For example, during Hurricane Sandy, Healthcare Ready coordinated police escorts for deliveries. That took 2 days after the event, but we were able to get a number of deliveries in with a police escort because we knew the right folks to coordinate with to ensure on the ground they were going to have the escorts there. So just to wrap it up, we're going to talk a little bit about recommendations. This is the third part of our report. And also I want to highlight in our report, we wanted this to be useful and not just an examination of the issue. We also wanted to find some kind of tools for the folks that read it. So you'll see, as the first appendix, a state-by-state guide to programs that exist, all of the laws that are applicable, who their EOC liaisons are, who the right people to contact are, and contact information where it was appropriate. We didn't put individual contact information, but organization-wide. So it's actually a state-by-state tool that you can keep on your desk, so when these things happen, you can figure out who to talk to and who to coordinate with and who to call. But the recommendations we've provided, they're very high level, more details in the report, and frankly, we'd be happy to coordinate with any of you offline to talk about a lot of these. But they're broken down into 3 buckets: developing a program, running a program, and then if you're going to have these ad hoc solutions, these are things you should consider for it. Our goal here is really just to get people thinking about the complexities and all the things they should consider while developing these. So I have a couple, just 2 slides of highlights where we'll talk about establishing a program and ad hoc solutions. But, the number one thing is that this is an issue that isn't talked about a ton. So it's not an issue where if you're in a state and you're developing a program, you know what other states to call to figure out how they already solved it. And so really it's important to look at these best practices, look at the folks who have walked in front of you and have developed these programs, and look at their best practices and how they've done it. And we can't recommend that enough. We know that I think it was Florida used Model law for North Carolinas, and we've seen some of that growth. But we've also heard from states who are considering programs who didn't even know that another program existed in the rest of the country. So we've seen it both. And then as well, I have a lot of things here that we've already talked about, just in time and figuring out who's critical and all of those things. But number 5, I just want to highlight it. It's great to have, an app. It's great to have a badge. It's great to have everyone in a database, and that's wonderful. Almost every event I've seen, communications have gone down or have been horrible or only had, text messaging 24 hours later. It really depends. And so I can't stress enough, that having more than one way to get someone a badge is incredibly important. Have a way for them to download it and then still have it, but also make sure the person on the ground at the checkpoint has a way to review them and let them in that doesn't rely on technology, because we've really seen challenges with that in different events. And just for ad hoc solutions, I mean, we know that every state is not going to happen and they're not going to make a program. We overall recommend that trying to put in some kind of a formal program, trying to socialize it, trying to even socialize who your contacts are in all of these places is incredibly important. Even for Healthcare Ready, with a nonprofit that's focused on healthcare and disasters, it can be really hard for us to know the right person in the state and the emergency management agency to coordinate with for these things. And so having a public way to push out this is who you can call, that I can't overstate that enough. But consider having multiple things. And one of the other things we've had, as working with the National Governors Association and other folks, is that when it's time to write an emergency declaration, it's time to develop these things, it's kind of starting from the drawing board, and they kind of do the best they can. There aren't great templates for all of these things, especially on this issue. So spending some time to think about it ahead of time. Emergency declarations are hard, right, because you want specificity. You want to say things like, let in supply chain, let in all these things, but understanding the specificity for every sector is incredibly important, and it's hard, and it's hard to have all of that in one emergency declaration. So the more you can talk through who is critical, what to put in the declaration ahead of time, it's going to be so much more effective when you do it. And just in conclusion, before we go to questions, actually, can you go to the next slide so I know where the report is? Thank you. So, again, is the URL to find our report on our website. There's been a lot of progress made on this, and I think it is a challenging solution, and it can be frustrating in the time. But I think we can't overlook that all of a sudden there's more attention being paid on it, more states that are creating either just private sector representatives and DEath or BEOCs who are really starting to coordinate on this issue, and that's a growth that we haven't seen until recently. And that formal programs and our recommendation are the best way to go. Have at least some kind of a database, have some kind of something that you've already communicated out to law enforcement. But really, it's a complex problem, and frankly, we recommend more than one solution. We don't recommend waiting to hope that one of the programs is turned on or that you can access it. If you can also come up with a draft access letter, if you can already have coordinated with some of these federal agencies so they know who you are and what you could need, you're going to be that much closer in those times to really getting what you need. So with that, I know I have talked a lot. Let's just leave it on this one. I think I'm going to pause. I see a couple questions in the window, but are there questions on the call? Just as a reminder, you can type questions into the chat box, or unmute your phone to ask a question. Yes, you can also unmute your phone and ask a question through the teleconference line. And one of the things that we've also seen is when folks are trying to push for different solutions, we've seen effort. The only way we're going to start developing solutions to this program is if we start making noise about it, right? And we've seen from the health distributors, HDA, we've seen them push that, and we've seen them get legislation up in New York State to try to talk about this issue, and it means they're really paying attention to this issue. So I think part of our challenge as well is not just saying that there is, this is what's out there, this is the problem, but also if we talk about it and talk about how this is a legitimate problem and push for some kind of a solution, we're going to be much more effective at getting things done. There are a few considerations in the chat box that are worth mentioning, and Emily, if you'd like to speak to that. I agree completely with who's critical can be tricky. We've heard this everywhere. We've also heard it with, in these times of disaster, maybe hospitals are critical, but our primary care facilities, are there other types of facilities? What about pharmacies? We get that all the time. Are pharmacists critical or drug deliveries? And the answer is yes, but the answer is but, because I think that the companies should be able to decide for themselves which goals are critical, which facilities are critical, and really push for those, really to help them get in. There's also a a comment about document and access path integrity or security in consideration. Yeah, that's really hard. And during these events, what we've seen is a trade-off between trying to get things moving and the loss of security on some of these things. And so when they're electronic, it's much easier to do it and verify it. But we've often seen at the state level and in the EOC that folks have decided that it's more important to get a badge or an access letter in the hands of someone than it is to ensure that it's always the right person. We haven't heard of issues with people taking the letter or using it, but we haven't heard of any outcomes, negative outcomes coming from that. We haven't heard of any theft or vandalism or anything from folks doing it. It oftentimes is more of a absent-minded or lost it, can't find it sort of issue as opposed to actual, crime with it. There's a question asking for the name of the North Carolina private sector liaison. The Persia Payne Holly. Persia Payne Holly. She's, if you want to email us, actually you can go to the next slide, say my info. I'll happily connect you directly. North Carolina has some of the best efforts I've seen with private sector coordination across the board and constant communication, which is something that is very much appreciated. And we also have information in the report in the appendix that actually has the EOC information, but if you want Persia's information directly, let me know.
I do remember meeting her at an as-is meeting about, I think it was last month. She was very over the top, very passionate about her job. I'm pretty sure this is the same young lady.
That's her.
Okay, it's got to be one Persia. Okay.
Emily, this is Laura. Just curious, have the efforts at the state level embraced sort of law enforcement, and is law enforcement an issue beyond state law enforcement? Does it, it's in certain incidents, do we see national sorts of law enforcement, whether it's FBI or anyone like that, getting involved in these challenges?
Excellent point. Yeah, that has been a massive challenge because oftentimes communicating the need for private sector access is understood fairly well at the Emergency Management Association. It's not understood that well with law enforcement. And then in addition to that, just as you said, sometimes it's local law enforcement, state troopers or police, sometimes it's National Guard. And then if we're looking at something like the Orlando shootings where they shut down some of the areas, well, that was FBI because it was considered domestic terrorism. So that was an entirely different agency that you had to try to coordinate with. And it makes it very difficult to do it. One of the things we heard was that and folks at the state level created a program. It's on page 87 of a police officer's handbook that, they saw maybe once in orientation, and then when it turns on, they're not ready for it. So one of the things we certainly recommend is that these programs be made flexible so that it's not just for catastrophic events. Let's find a way to make it so it's turned on at least once a year, whether it's the state fair or a smaller event or something that, at least you're getting familiarity with it, and they'll have a reason to have seen a badge before or have seen someone requesting it. And it also helps get the word out that it exists. An interesting model in exactly that is New Orleans, which activates for every large event. And they are pretty fortunate that they have a lot of events to activate for, whether they be music festivals or even football games. But those essentially become opportunities for them to do exactly what Emily's saying and just really run through and make sure that all of their systems are in place and working.
Do we have any more questions for Emily or Nicolette?
There's a question about lessons learned from the recent flooding in Baton Rouge. I love it. Thank you for asking that question. I was really impressed. So we activated Healthcare Ready, our highest activation level for over a week, or coordinating and connecting with supply chain. And Louisiana, unfortunately, but fortunately gets it. And they've been very good at this public-private sector coordination. And on every day, on every call, one of the biggest topics I heard was economic recovery. And economic recovery is not something that I routinely hear when we're talking about response. but it was an area that got it. If we don't get people back to work, if we don't get schools up and running, if we don't get people, able to stay in their homes, it's going to be like Hurricane Katrina, where people are displaced and then never ever come back. So, for the flooding response, I have to say I was very impressed. The Louisiana Business Emergency Operations Center that coordinated it, but there was just an understanding that these things had to continue to flow and happen. The other thing that we saw was very little supply chain disruption, which frankly I was waiting for, and I kept waiting for the call, and I was pretty surprised. But within 12 hours to 24 hours after we were hearing about the floods, so it was a Sunday night, it was a Monday morning, I was getting these calls saying, yeah, 99% of our deliveries can make it through. If the facility's open, we're in. And so the issues we saw with supply chain was when, we worked with some rural health clinics that were flooded out and destroyed, trying to find them temporary facilities or something else. But if it was open, things were getting where they needed to go. So I think with that was big kudos to Louisiana for really understanding that need. The governor also, one of the things we saw in Louisiana is that the governor placed one of his staffers in every one of the major shelters to make sure that the shelters were having access to health care. And so it allowed the folks who are in the shelter actually to work and help the shelterees, but it also allows us to have someone to contact to understand what the medical needs were there so we could facilitate it as well. And I recognize that's not access related, but it frankly was an impressive step. Are there any final questions? Okay, Laura, we'll turn it back over to you.
Thanks so much. Thanks to you, Nicolette, and to Emily. We continue to have a webinar series based around various issues related to critical infrastructure security and response. So please continue to look for invites to our emails for future webinars. And on October 24th and 25th, we're hosting our partnership meeting with public and private sector partners. So look for more information on that coming soon and opportunities to register for that. Thanks all for participating. If there are additional questions, feel free to send them to cip@hhs.gov, and we will get them over to Emily for resolution. So thanks to everyone for participating in the call, and you are free to drop.
Thank you.
Thank you all.